Welcome back to What's Now, turning our attention to your health. The Leukemia and Lymphoma Society is leading the charge to improve care and conditions, especially for children with blood cancers. I recently spoke to a mom of a pediatric cancer survivor, as well as a representative from the Leukemia and Lymphoma Society. All about this, here's more.
The Leukemia and Lymphoma Society is leading the charge to improve treatment, care, and outcomes for children with blood cancer. Today, I have the opportunity to speak with Courtney Addison, mother of a pediatric cancer survivor, as well as Dr. Gwen Nichols, Chief Medical Officer of the Leukemia and Lymphoma Society. So grateful that they're both with us today. Courtney, let's start with you. Tell me more about Caden's journey.
Yes, so my son Caden was diagnosed in March of 2020 at the age of 3 with acute lymphoblastic leukemia. Shortly after we found out his diagnosis, we were told that he had a very rare form that only happens in about 3% of cases. And as you can imagine, we were incredibly devastated. So essentially what this meant was that he went from standard care of treatment to something that was more intensive and unfortunately led to more severe complications and side effects due to that treatment. So he had to undergo chemotherapy, tons of surgeries, as well as several overnight hospital stays that sometimes lasted for several weeks.
Courtney, how did the Leukemia and Lymphoma Society help you and your family throughout this experience? And what made you decide to become a champion for the work they are doing now?
So I was actually introduced to LLS shortly after Caden's diagnosis through one of their fundraising events. And through that, I learned a lot more about what they do, including a ton of research for childhood cancer research, which is something that was important to me. And through that, I was also able to learn about a lot of their educational resources that really helped me as a mother. So as you can imagine, as a parent, it was devastating, and I felt like I had no sense of control. And so I was able to utilize those educational resources to be able to advocate for my son Caden, to make sure that he was getting the best care and treatment during those doctor's appointments.
Dr. Nichols, tell me more about the importance of LLS in expanding its commitment to pediatric blood cancer patients.
So far too long, while we've made strides, amazing strides, in getting more children cured of their cancer, we have done it through giving them therapies developed for adults and just modified for children. And the more research we do, the more we understand that these therapies are some of them are exactly what children need, but many of them don't address the biologic differences between what causes cancer in a 6-year-old versus a 60-year-old. And that we need to change the development paradigm and remove the roadblocks in the way that are keeping us from developing medicines specifically for the types of abnormalities that we see in childhood leukemias. And so that's really, we want kids to thrive after their treatment, not just be cured. Cure is, of course, the most important, but we want healthy adults when we're on the other side of that treatment.
Dr. Nichols, how is the Dare to Dream project setting out to transform treatment and care for kids with blood cancer?
Well, because of this goal, we have focused our research efforts specifically for the biology of childhood leukemias. And along with this, we've realized that in order to develop new therapies, we need to have a global collaborative process. No single institution or even group of institutions. We have wonderful, wonderful pediatric hospitals in the United States, but none of them can do this alone. It needs a collaborative effort in the US, in Canada, in Europe, in all parts of the world that are developing drugs. We need to share information and we need to consolidate our resources, and LLS is doing that so that we can do a global master trial specifically for kids with hard to treat leukemias.
Courtney, any final thoughts for us, especially as a mother who's been through this with your child?
Yeah, this was something that I never would have imagined us going through in a million years, and it was absolutely awful. And I really appreciate what LLS is doing because they are looking at the kids holistically, and I think that's what's so important. So any parent that's going through this, please reach out to them. There are tons of resources available, and there are lots of ways to get involved and help out. Even if you haven't personally been touched, if you want to donate and to give and to get involved, there's plenty of opportunities available.
And Dr. Nichols, where can we learn more?
Well, I'd really love to invite people to go to our website, lls.org, where you can learn all about the Dare to Dream project, but also about all the resources and support that we have for patients. And if your viewers have blood cancer themselves or know someone, a family member who is going through this, a friend, all of our resources are free. We would love them to contact us so that we can provide the kind of help that Courtney described. Please either go to our website, lls.org, or call our 1-800-955-4572. And again, all of this is free. We're here to help.
Thank you so much, Dr. Nichols and Courtney, for joining us today. Really appreciate this important information about how the Leukemia and Lymphoma Society is leading the charge to improve treatment, especially for kids with cancer. Thank you so much.
Thank you.